The domino effect down south, why your UTIs, BV, and yeast issues are actually connected. If you have ever cleared up a urinary tract infection only to immediately get a yeast infection, or felt like you were stuck in a never-ending cycle of bacterial vaginosis, or BV, you are not alone. And no, it's not just bad luck. Clinically, we have to look at what I call the female pelvic triangle, the interconnected ecosystem of your gut, your bladder, and your vaginal microbiome. They do not live in isolation. When the microflora shifts in one area, it creates a domino effect across them all. As a nurse practitioner, I want to break down exactly what is happening under the surface when things go off the rails. In a healthy vaginal ecosystem, a strain of good bacteria called Lactobacilli is the absolute queen. It produces lactic acid, keeping your environment perfectly acidic. This acidity is your body's natural defense system. It creates an environment where harmful bacteria and yeast simply cannot thrive. But then life happens. Hormonal shifts like dropping estrogen during midlife or menopause, stress, or antibiotics can cause your Lactobacilli population to plummet. When pH rises, you get BV. Without enough lactic acid, your pH goes up. This allows opportunistic bacteria to overgrow, leading to the irritation and discharge of BV. When the environment changes, yeast imbalances happen. Candida is naturally present in small amounts, but when the protective shield drops, yeast seizes the opportunity to multiply. Then there's the migration to UTIs. If the bad bacteria dominate the vaginal area, they can easily migrate into the urethra and travel up to the bladder, triggering a UTI. Stopping this cycle isn't about constantly taking heavy-handed antibiotics that wipe out the good bacteria. It's about aggressively supporting and protecting the ecosystem. That is why I am so glad my sample box from Solv Wellness arrived, because it prompted me to create a post about these issues. Their line targets this exact pelvic triangle with clinical strength, non-hormonal logic. Mage, a 3-in-1 prebiotic and probiotic specifically engineered to restock the good bacteria across the gut, vagina, and urinary tract so the right microbes stay in control. Jenna MD, a urologist recommended bladder shield that uses verified soluble pack to physically stop UTI-causing bacteria from clinging to your bladder wall. Via, an FDA-cleared moisturizer that uses pharmaceutical-grade hyaluronic acid to heal and hydrate the tissue barrier, which is essential because healthy tissues are the foundation for a healthy microbiome. The bottom line, if you are tired of chasing symptoms and treating your bladder and vaginal health like separate issues, it's time to look at the whole picture. Rebuilding your microbiome takes time, but with the right clinical tools, you can absolutely break the cycle. Visit solvwellness.com to explore these wonderful products. Stay radiant.